Government-subsidized health insurance for new lawmakers like Joe Walsh kicked in this week, but the Tea Party-backed Republican campaigned hard against the health care law, so he's opting out of benefits for himself.
This piece of legislation that we passed last year is so critical, and I think it's going to do such harm to our country that I think we need a few of us to lead by example to point out some of its flaws.
So despite his new congressional perks, Walsh is buying his own health care. His wife has a pre-existing condition, so private insurance won't cover her.
If I'd have taken the congressional plan and I've taken the group policy, my wife's condition would have been covered and life would have been a heck of a lot easier. But this is a pledge that I made.
Walsh is only one of 17 House Republicans not accepting the congressional health care benefit. CNN checked with them all, and most are opting out because they have other insurance that's more practical, not out of principle. The vast majority of Republicans are enrolling, and Democrats are crying foul.
I personally think it's hypocritical when they all voted to undo the bill we did.
Members of Congress are eligible for the same health benefits as some 8 million other federal employees. A wide range of private plans to choose from, subsidized by the federal government, but cheaper because the pool of people is so large. That's the same theory behind so-called exchanges in the new health care law, which Republicans oppose.
Much of which we were modeling it on was what we as members of Congress have. And so the idea that they're coming here and they're fighting against providing those opportunities for the average American who doesn't have it today, I just feel it's hypocritical.
Most Republicans scoff at that. Aides to all 13 new GOP senators tell CNN they will accept congressional health benefits. All Republicans voted to repeal the health care law. But Tea Party favorite Rand Paul insists it's apples and oranges.
I've always had my health care through my employment. When I was my self-employer, I provided it, and now I'll get it through my employer. I don't really get the connection, though, between that and the health care debate, since the health care debate is about whether or not you can force people to buy insurance, not about whether or not you get your insurance through your employer.
In conversations with dozens of Republican aides and lawmakers accepting congressional health benefits, the response was similar to Rand Paul's. They insist there's nothing contradictory about opposing what they call a flawed health care law and accepting health insurance from their employer, which in the case of members of Congress is the federal government. Dana Bash, CNN, Capitol Hill.